have the back of our hand. Ooh, between our fingers and wrist and fist and wrist. Wash harder. Wrist and fist and wrist. More water.
Scrub it, watch it really good.
Wash it really good.
Scrub it, watch it really good.
Wash it really good.
Knuckles, wash away your troubles. Wash it really good.
Wash it really good.
Put the soap on my hands.
We put the soap on our hands.
I rub the palms on my hands.
We got the palms of our hands.
Scrub my little index finger. Scrub my little middle finger. Scrub my little ring finger. Scrub my little pinky finger.
Don't forget the thumbs, scrub it.
I won't forget my thumbs, I'm scrubbing.
Don't forget your nails, scrub 'em.
I won't forget my nails, I'm scrubbing.
Ooh, now the back of our hands. Ooh, between my fingers and wrist and fist and wrist. Wash harder. Wrist and fist and wrist. More water.
Scrub it, watch it really good.
Wash it really good.
Scrub it, watch it really good.
Wash it really good.
Knuckles, wash away your troubles.
Wash it really good. Wash it really good. Oh!
Hands so clean. So pristine, teen. Hands so clean.
So pristine.
Woohoo! Fun song!
Bobo and Titi. Bobo and Titi and friends.
Scrub it, wash it really good.
Wash it really good.
Scrub it, wash it really good.
Wash it really good.
Ready to wash your hands? Okay, let's sing.
We put the soap on our hands. We put the soap on our hands. We got the pom-poms up our hands. We got the pom-poms up our hands. And scrub our little index finger. Scrub our little middle finger. Scrub our little ring finger. Scrub our little pinky finger. Don't forget the thumb, scrub it. I won't forget my thumbs, I'm scrubbing. Don't forget your nails, scrub 'em. I won't forget my nails, I'm scrubbing. Ooh, now the back of our hands. Ooh, between our fingers and wrist and fist and wrist. Wash harder. Wrist and fist and wrist. More water.
Scrub it, wash it really good.
Wash it really good.
Scrub it, wash it really good.
Wash it really good.
Knuckles, wash away your troubles. Wash it really good.
Wash it really
I
good.
put the soap on my hands.
We put the soap on our hands.
I rub the palms on my hands.
We got the pom-poms up our hands. And
Scrub my little index finger. Scrub my little middle finger. Scrub my little ring finger. Scrub my little pinky finger.
don't forget the thumb, scrub it.
I won't forget my thumbs, I'm scrubbing.
Don't forget your nails, scrub 'em.
I won't forget my nails, I'm scrubbing.
Ooh, now the back of our hands. Ooh, between my fingers and wrist and fist and wrist. Wash harder. Wrist and fist and wrist. More water.
Scrub it, wash it really good.
Wash it really good.
Scrub it, wash it really good.
Wash it really good.
Knuckles, wash away your troubles.
Wash it really good. Wash it really good.
Oh,
Hands so clean. So pristine, teen. Hands so clean.
So pristine.
woohoo, fun song.
Bobo and Titi. Bobo and Titi. And friends.
scrub it, wash it really good.
Wash it really good.
Scrub it, wash it really good.
Wash it really good.
Ready to wash your hands? Okay, let's sing.
We put the soap on our hands. We put the soap on our hands. We rub the palms up our hands. We rub the palms up our hands. And scrub our little index finger. Scrub our little middle finger. Scrub our little ring finger. Scrub our little pinky finger. Don't forget the thumb, scrub it. I won't forget my thumbs, I'm scrubbing. Don't forget your nails, scrub 'em. I won't forget my nails, I'm scrubbing. Ooh, and out the back of our hands. Ooh, between our fingers and wrist and fist and wrist. Wash harder. Wrist and fist and wrist. More water.
Scrub it, wash it really good.
Wash it really good.
Scrub it, wash it really good.
Wash it really good.
Knuckles, wash away your troubles, wash it really good.
Wash it really good.
Put the soap on my hands.
We put the soap on our hands.
I rub the palms on my hands.
We rub the palms up our hands. And
Scrub my little index finger. Scrub my little middle finger. Scrub my little ring finger. Scrub my little pinky finger.
don't forget the thumb, scrub it.
I won't forget my thumbs, I'm scrubbing.
Don't forget your nails, scrub 'em.
I won't forget my nails, I'm scrubbing.
Ooh, and out the back of our hands. Ooh, between my fingers and wrist and fist and wrist. Wash harder. Wrist and fist and wrist. More water.
Scrub it, wash it really good.
Wash it really good.
Scrub it, wash it really good.
Wash it really good.
Knuckles, wash away your troubles, wash
Wash
it
it
really
really
good.
good. Wash it really good.
Oh,
Hands so clean. So pristine, teen. Hands so clean.
So pristine.
woohoo! Fun song. Bobo and Titi. Bobo and Titi and friends.
Scrub it, watch it really good.
Wash it really good.
Scrub it, watch it really good.
Wash it really good.
Ready to wash your hands? Okay, let's sing.
We put the soap on our hands. We put the soap on our hands. We rub the pom-poms up our hands. We rub the pom-poms up our hands. And scrub our little index finger. Scrub our little middle finger. Scrub our little ring finger. Scrub our little pinky finger. Don't forget the thumbs, scrub it. I won't forget my thumbs, I'm scrubbing. Don't forget your nails, scrub 'em. I won't forget my nails, I'm scrubbing. Ooh, now the back of our hands. Ooh, between our fingers and wrist and fist and wrist. Wash harder. Wrist and fist and wrist. More water.
Scrub it, watch it really good.
Wash it really good.
Scrub it, watch it really good.
Wash it really good.
Knuckles, wash away your trouble, wash it really good.
Wash it really good.
Put the soap on my hands.
We put the soap on our hands.
I rub the palms on my hands.
We rub the pom-poms up our hands. And
Scrub my little index finger, scrub my little middle finger, scrub my little ring finger, scrub my little pinky finger.
don't forget the thumbs, scrub it.
I won't forget my thumbs, I'm scrubbing.
Don't forget your nails, scrub 'em.
I won't forget my nails, I'm scrubbing.
Hello, everyone, and welcome to our Friday coronavirus press briefing. I'm Donna Bush. Welcome to everyone who's joining us on the channel via our social media platforms as well as via Radio Cayman. We begin with a prayer from Pastor Chris Mason.
Let us pray. Eternal God, amid all the turmoil and changes of the world, your love is steadfast and your strength never fails. In this time of uncertainty and distress, be to us a sure guardian and rock of defense. Guide the leaders of our nation with your wisdom. Comfort those in distress, and grant us courage and hope to face the future. God of compassion, be close to those who are ill, those who are afraid or in isolation. In their loneliness, be their consolation. In their anxiety, be their hope. Be in their darkness, be their light. Through Jesus Christ, our Savior and Lord, we pray. Amen.
Amen. Now we welcome our panelists, His Excellency the Governor, the Honourable Premier, and the Honourable Minister of Health. Also joining us in our studio are the Chief Medical Officer, as well as the Director of HMCI, and of course our sign language interpreter. And joining us via Zoom, we have members of the media, as well as the Medical Officer of Health, Dr. Samuel Williams Rodriguez. Now we go to Dr. Lee.
Good afternoon. There are a further 154 tests to report today, 4 of which are positive, 2 are connected with previous positive cases, and 2 are community acquired. These results date to samples taken up to the 21st of April. That brings our total to 70 positive, of whom 33 are symptomatic, 22 asymptomatic, 6 of whom are admitted, 4 at the Health Services Authority, which is an increase of 1, and 8 of whom are recovered. I wanted to say I'm very sorry that the results are not yet available for the people who were on the British Airways flight over a fortnight ago. I realize it's exceedingly disappointing for you, and I really appreciate your patience. The explanation, there is an explanation. It's never good to be on the end of disappointing news, but the explanation is that we've had to move from an automatic process for part of the management of the results to a manual process, and that's put quite a strain on the system. It's made us a lot slower at being able to process the results. Your results are the next that should come off the conveyor belt for the results. I'm hopeful that they'll be available later today, and we will share them with you as soon as we can. It could be tomorrow, but I'm hopeful it might be later today. So apologies from me and apologies from everybody at Public Health for that inconvenience. I'm pleased to report that Doctors Hospital are now able to test, and they've started testing people. So there's a lot of good news all around today, and I think there'll be more from the panel later on. Thank you, Donna.
All right, thank you very much, Dr. Lee. We should also mention that the Commissioner of Police is not with us today. He will be joining us, as he mentioned, once a week going forward. So we now move on to the panel, starting with our Honourable Premier.
Thank you. Hello, everyone. I think everyone is aware that we had a very eventful meeting of the Legislative Assembly yesterday, and indeed the day before. And we were able to pass all of the pieces of legislation that we needed to pass to ensure that we are able to respond effectively to the crisis, the economic crisis that we are facing. These bills were all dealing with the social and economic consequences of the pandemic that we are struggling with. So we got through the National Pensions Law the amendment. We got through the amendments to the immigration law. We got through the amendments to the Customs and Border Control law. We got through the amendments to the traffic law. And I think we are now in a good place to be able to ensure that we can, as far as possible, allow people access to more funds from their pension accounts, that people are able to license their vehicles, that we were able to put in place an amnesty for people who, because of the circumstances, have been unable to regularize their immigration status in the country. And I think now we are in generally a good place there. The results of the recent testing I find encouraging. There are only 4 positives, and 3 of those are connected to previous cases. I think that is very encouraging. I think the results over the course of the next week or 10 days will be very telling, and will certainly help shape what the rest of the response or the next response of the government will be to the crisis. I'm hopeful, as I keep saying, that if the results continue as favorably as they have recently, that we will be able to, in relatively short order, start to ease some of the restrictions, and certainly particularly in relation to Cayman-Bracken, Little Cayman, which continue to have very, very encouraging results.
Okay. Thank you. Premier McLaughlin, Your Excellency.
Yes, thank you. Thank you very much, and good afternoon, everybody. Like the Premier, I'm also greatly encouraged by those results. I think that does show that, again, our strategy is working, and as we now ramp up testing, we do, as the Premier says, have an opportunity to really see what this looks like as we start to think about what comes next. But I think we can have hope and some reassurance that we're in as good a place as we could be. And I do also want to add my thoughts to the people who are in our isolation centre. I know this is very difficult, and just to say that we are very grateful to you all for your continued patience. Secondly, today, I just want to say that in terms of how we get supplies in to help our testing system, about a week ago, we were not in such a good place and extremely concerned that we wouldn't be able to get the supplies in. We haven't said very much on that in recent days, but a lot of work has been going on, and I'm really pleased to say today that we're now very confident that we do have sufficient swabs and extraction kits either already here or coming very soon to be able to really step up this massively important testing programme. And today I want to pay tribute particularly to Dawn Cummings at HSA and also Matthew Forbes in my office, because between them, they have done a huge amount on this. And my office is particularly focused on the extraction kits and the swabs. Dawn is involved in all sorts of PPE orders. And as an example of the UK's diplomatic network really supporting us, our consulate in Guangzhou in China did fantastic work for us on swabs, lobbying the Chinese Foreign Ministry and working with FedEx to get a delivery of swabs to us. So I think that is all really welcome. Just on flights and evacuations, I think I can say today, I think you'll all be aware, we have a second flight to Miami on the 1st of May. The first flight sold out very quickly in under 2 hours. So there are still some spaces and seats available on that flight. I'm also pleased today to announce that we are working very closely with the Mexican government, and there will be a flight to Cancun, Mexico next week to take back Mexican nationals. So if you wish to go on that flight, please do contact or email emergencytravel@gov.ky and register. We're also in good shape on the British Airways Airbridge, which comes in on Tuesday. We have about 57 people returning on that flight at the moment. It's bringing in needed kit, extraction kits and swabs, and the UK security team. I also want to sort of say to people that if you are on that flight, you can take 2 23-kilogram pieces of hold luggage rather than one. So I hope that is a welcome announcement. I'm also pleased to announce that we have a new online form for the Emergency Travel Helpline, and you can upload your details directly onto this form, and we'll put details of that out on social media after this. I've also been asked just to underline that if you have work permit issues, do not contact the emergency travel hotline. That's not for work permit issues. They should go to work in the normal way. So I just wanted to make that clear. And then finally, I want to do a shout out today also to the Attorney General and the Solicitor General and the legal drafting team. The Premier himself has also thanked them, but the Attorney General is also my legal advisor, and I get excellent support and advice from him, and they have continued to provide high-quality legal advice while continuing to deal with ongoing court cases, and they've done a truly wonderful job on helping us with the COVID-19 regulations and amendments. So a big thank you to them.
Thank you, Your Excellency. Minister of Health.
Thank you, Donna. Good afternoon, everyone. Grand Cayman, Cayman Brac, and Little Cayman, and all our Caymanian diaspora listening in. I want to say thanks to Sharda for the scriptures sent from Psalm 61 and Philippians 4. Hear my cry, O God, attend to my prayer. From the end of the earth I will cry to you when my heart is overwhelmed. Lead me to the rock that is higher than I. I am not saying this because I need anything. Over the years, I've learned to be content with whatever I have and to live with the circumstances in which I find myself. I know from my experience what it's like to be in extreme need and also what it's like to have more than I need. I've learned the secret of being happy wherever I am, whether hungry or well-fed, whether I have little or much. I can do anything through Christ who gives me strength. Philippians 4. The translations today, in our efforts to have people stay home, please stay home in Hawaiian and Samoan. In Hawaiian, it's I ulu ulu I noho Maka Hom. And Samoan, it's Fa Amol Imole Nofo I Le Faki. Thank you. That was close. I wanted to give a shout out to the Cayman Islands Monetary Authority and their hardworking team and leadership. I thank you, SEMA. Also want to give Ms. Delva a shout out for making the clips for the HSA medical staff to ensure their masks are fastened properly, at the same time comfortable. I thank you very much, Ms. Delva. Also wanted to shout out the physicians and the nurses assisting with the flu clinic. You're doing a wonderful job. Keep it up. God bless you. Also, we're still having my little pet peeve of problems with the banks. That concern is still there, and we may have to act on that in terms of comfort for persons attending the bank nowadays, and the hours being so short and the locations being so only one location. Also, I've been getting a lot of messages from persons who are having trouble with their strata, and stratas are foreclosing on persons at this time in a crisis. I don't know who would be so heartless at a time like this, but we definitely need to look at the strata titles law. Over the past 2 weeks, I've highlighted the work of many teams and individuals across the healthcare industry to ensure we have required resources to provide safe and effective care to any resident impacted by COVID-19. While the work in collaboration between the Ministry of Health, the Chief Medical Officer, the Public Health Department, and the various teams in the private and public sector has been commendable, I want today to single out the equally important role of one of our key partners, the Health Insurance Standing Committee of the Cayman Islands Insurance Association. From the outset of the COVID-19 pandemic, the member companies of the health insurance industry have stepped forward in an incredible way through a range of initiatives. This includes participating in the daily NEOP meetings to ensure continuity of caring to their clients and the financial sustainability of the healthcare system, including a waiver of exclusions that would have prevented persons from receiving care required due to this pandemic. Continuing dialogue regarding coverage of consultations via telemedicine with healthcare providers, expediting claim payments to healthcare providers on the front line, processing bills and claims electronically to ensure reimbursement payments are not interrupted. Many of these initiatives will come at significant cost to the health insurance industry, but it reflects their ongoing commitment to the health and well-being of their customers in the community, as well as the safety of people coming first. Myself, along with the acting chief officer, Ms. Nellie Pucci, the superintendent of health insurance, Mr. Mervyn Conley, and others in my ministry have been in discussions concerning how the government may be able to provide some level of support in regards to health insurance to those persons working in industries most affected by this crisis. We expect to present a proposal to Cabinet in this regard in the coming week. Basically, if premiums are not paid, then the insurance companies will not be able to pay claims. And if persons aren't able to pay the premiums, insurance companies will not be able to provide the level of coverage long term. As I said, the ministry, the Health Insurance Standing Committee, and various stakeholders are currently looking into various issues, and a further update will follow. I've also heard of many of the insurance companies finding ways of supporting clients, as well as first responders, and I want to publicly commend the industry for their proactive approach in this regard during this public health emergency. On another note, we continue to use this forum to inform the public on the vital information related to COVID-19 disease, and I will be working with the HSA in Public Health to offer general information on the various services still available at our facilities. Today we want to highlight the Family Planning Clinic. Sessions have been reduced but available through the week as needed. Phone consultations are also being done by doctors to address all family planning concerns and to answer any questions people may have in this regard. I understand that missed appointments are also promptly being rescheduled. All family planning methods continue to be offered, such as injectables, intrauterine device, subdermal implants, oral contraceptive pills, and condoms. I'm also told that persons categorized at high risk or challenged patients are strictly followed up with and accommodated as needed. In addition, the clinics are still being run from 9 a.m. to 4 p.m. using the same surname alphabetical system to which you're all aware. The reason for this reduced service is in keeping with the social distancing requirement. We're also accommodating essential workers outside of clinic hours as needed. Just want to thank our medical teams again for all their hard work and all their perseverance. We appreciate you all. Remember, unless you must go out for essential tasks, we are asking you to stay at home, as staying home does save lives. Thank you, and God bless.
Thank you, Minister Seymour. We are going to move now to the media, and I believe
Donna,
their first set of questions.
if you don't mind, I have two short announcements I've been asked to make.
Absolutely, Premier McLaughlin.
One is from the Ministry of Education, which is reiterating some of the previous announcement made. The Ministry of Education, Youth, Sports, Agriculture and Lands have announced that under the advice and with approval of the Cabinet, all educational institutions will remain closed for the duration of the 2019-2020 academic school year. This decision is a result of the current and potential impact of the COVID-19 coronavirus to the Cayman Islands. Educational institutions include all early childhood care and education centers, nurseries, preschools and daycare, infant, primary and secondary schools, tutoring centers, technical and vocational institutions, colleges and universities. As the academic year is still in effect, all schools, that is all compulsory education institutions, are expected to continue distance learning. And then a really nice announcement, an acknowledgement. Some of our elderly were surprised this week when they shopped between 7 a.m. and 8 a.m. Our electricity provider in Grand Cayman, CUC, arranged to pay for their groceries at 2 supermarkets this week. We understand that this goodwill will be extended at another supermarket next week. On behalf of the government and everyone, I believe, thank you, CUC.
Yes.
Thank you very much, Premier McLaughlin. We're going to call on Dr. Lee as members of the media have some questions for him, and then we'll move to the rest of the panel. Let's begin our question and answer session with Wendy from CNS.
Thank you, Donna. I have a couple of questions for Dr. Lee. First of all, the test results today, I just want to clarify, these were all test results that would have been done under the old PAHO criteria, so no. Either there were connections or they're not any of the screening tests yet?
No, there's some screening tests mixed in there.
Oh, right, okay. Are you able to say if any of the screening tests were the positive ones?
I haven't been provided. Oh, no, they weren't, but I can tell you that. But I haven't got a disaggregation of them, but I know that the positives weren't any of the screens. Yeah, but there weren't there weren't very many screens in there. So I understand that the public, really want this information. So we try to give it to you as fast as we can. by giving it to you very fast, you get an advanced copy that wouldn't be normal. You'd normally get it going through several layers of processing, but we give it to you fast because you want it fast.
Right.
The sorts of figures you want often take a little while to digest. They need to be put into an Access database and then filtered, and then the answers can come out, which is why the answers that you think I should be able to give are often delayed by some time until I can provide them. But that's the reason, is that you're getting the raw figures rather than the processed ones, which take a finite length of time, and somebody needs to sit down and make sure it's correct before the information's given out. I hope that explains a little bit about that process.
Yeah, no, I understand perfectly, and I understand what you're saying. So, and yes, the issue is everybody's sort of chomping at the bit to get to these screening figures because of the importance of what they'll tell us. So at this point, now that we've also got the doctor's hospital doing tests, do you have a rough idea of actually how many of these screening samples have now been taken that we're waiting for?
We've got there's several hundred screens that have been taken.
Yeah,
but
you said 700
they're not the priority at the minute. We're trying to prioritize. We are prioritizing clinical tests and tests of people who are positive contacts and so on. So the screens will always get put to the back of the list, but for understandable reasons. So, you know, the next, we're really trying to push through the British Airways flight to get them released at the minute. And having, as Governor's announced, that the automatic kits have arrived on Ireland as of, I think, this morning, that will really help push that process through. And I suspect, I'm not asking them to, but I suspect there'll be work over the weekend to try and get the result, get through some of the work.
Okay, great. The other question relates to the situation surrounding quarantine. We've heard now that the quarantine hotels are pretty much full. Now, obviously, one assumes that some of those, but quite a lot of those British Airways people will leave, but we don't know for sure how many there will until you get the tests, of course. And then we have the situation where we've got at least another 69 people coming in next week on the British Airways flight. So have you got room for quarantine?
Yes.
For quarantining people?
Yes.
And are there other hotels that are stepping up, as it were?
We have plenty of capacity to manage those. The NEOC monitors that figure all the while, and we're not concerned about the people coming in on Tuesday. We'll be able to find them place.
Okay, great. My final question relates to the whole testing, the testing numbers. We're getting a lot of people who don't understand like how it is that if you've got 100,000 test kits, and obviously you need to test a person more than once, if we are to test every single person or virtually every single person on the island, that is enough. So can you just reassure the public again that the number of tests we've got would, if we wanted to fulfill the Premier's goal of testing everybody, it would be possible to do that? Or if indeed it is possible, or feasible at all.
Premier is shaking his head here.
Wendy, I've said many times we have more than enough kits to test everybody. I didn't say we were going to test everybody.
I think one of the other issues is Wendy, is that what we would, we may actually not, for example, if we're planning to send a large group back, or if a large group goes back, we may actually do a survey, a survey of that group to get some sort of feel for the positivity rate, rather than necessarily testing that entire group. We also have, we also have to bear in mind, yes, you've seen there is a throughput issue. You can't, even if you can do 200 to 300 a day, it takes a finite length of time to work through that to get to 100,000. And these test kits are going to expire at the end of the year. So you have to bear that in mind as well. We don't want to have expiring kits. We'd prefer to pass them on to somebody else who can use them, rather than have them expire in our freezer.
So we can get this confirmed that we have enough test kits to test everyone is just a comment from the Premier and not an actual aim or goal.
It's certainly not an aim that we currently have on our books. I mean, the reason to do that is for that type of testing is not clear. I mean, it would be perhaps more interesting to test everybody using the immunoglobulin test to see whether people have had the disease or haven't. That would be a more interesting place to go, I think. Because of the nature of the PCR, only telling you the answer at that moment in time, and the moment after that, you could become positive, if you see what I'm saying. Whereas
Yeah,
the
absolutely.
because the immunoglobulin test gives you a historical perspective, it's telling you you've had that test, you've had COVID at some point. That's a more valuable piece of information. And we will get to be able to do the immunoglobulin testing. You've probably seen that in the United Kingdom, they are starting to do a survey using IgG testing. So they're going to get a feel for what it is in their population. They will have a much higher positivity rate than us. That sort of testing will be open up to us in due course, and then we'll be starting to do that. But that's a blood test, so people are going to have to have a needle.
Thank you, Dr. Lee. I appreciate that.
Okay, thank you, Dr. Lee. If we could just stay there for a moment. We have Reshma from the Compass who has a few questions for you. Reshma?
Thank you, Donna. Good afternoon, Dr. Lee.
Good afternoon.
My questions relate to the expanded testing regime that is now in progress. Can you tell us what are the plans for the sister islands? Are they going to be included in this expanded testing? And if any of the results that you shared today or the test that you spoke about today included the sister island samples?
Yes and yes. So they are going to be included in the expanded program, and some of the results were from the sister islands.
Would you be able to share what plans would be for the sister islands expanded testing regime?
So, I mean, they're having the same testing on Cayman Brac. They're having the same testing as we're having on Grand Cayman. So at the moment we're in phase 1, all of the frontline healthcare workers are being tested. There's no prison there, but the prison population is being tested as part of phase 1. Phase 2, which will probably overlap with phase 1, is much broader and is seeking to test everybody who is currently working and facing the public. So people like supermarket workers, the police, social workers, that group, and that phase will partially start fairly soon. In that phase, we're also likely to test the whole of Little Cayman because there are such a small community and very well isolated, even more isolated than Cayman Brac. That is the plan at the moment. Phase 3 is a much more expanded program, which has not been exactly elucidated, but is likely, as I mentioned just now to Wendy, going to be a more of a sample program, like taking a sample from a large group who may be allowed out back to work earlier than the whole of the population.
Okay, thank you for that, Dr. Lee. Now, I didn't hear in there any plans for expanding testing to include the elderly homes. You know, that is one of the vulnerable groups.
They're being done. I didn't say it explicitly, yes, but they're in phase 1. So yeah, we will be working through those.
Okay, great, thank you. Now, we've all seen the international news and the fears of a second wave of COVID-19 hitting various countries, in particular China. Can you say if Cayman is still in its first wave, or where are we in terms of that trajectory on the life of this pandemic? And are we preparing for possible second wave if we have completed our first wave?
The sea has been very calm around Cayman for the last few weeks, and that has been the same in the disease process. It's been relatively calm. I don't think we've had any waves. We've had a few ripples, to use the analogy, because we've been suppressing so hard and from such an early period during our experience of this, which is what's kept it relatively calm, I believe. It is possible there's something that's region-specific, because if you look across the other Caribbean territories, many of them have not had the explosion that the people in the northern, colder hemispheres have been suffering. So it's possible there's something region-specific. I hope we never have to have a wave. That's what we're trying to avoid. That's what the Premier has said and the Governor has said, the Minister of Health have said. We really want to avoid, because that will bring with it a lot of people who get very sick. That's what we're trying to avoid. So we're still in suppression, which is about not having any waves at all. So we're not in wave 1, we're not in wave 2, but we could get a wave. And that's the concern, that when we unlock, the wave will come, which is why we're going to be watching very carefully. And also seeing what the results show us when we start to do this testing, because if there's not a lot of disease out there, well, it could show two things, actually. Sorry to go on. But it could show there's a lot of disease out there. That would be interesting. But it just hasn't appeared in the hospitals, and that's very interesting for Cayman. The other thing it might show is there's not a lot of disease out there. It'll show one of those two things. But either way, as we've said, the proof of the pudding is in the eating. We have not had lots of people flood our hospitals and push them to overcapacity.
Okay, great. Thank you very much, Dr. Lee.
Dr. Lee, I have a number of questions from the public, but I'm going to ask you one very specifically now. This one relates to the testing. When adults are tested, are kids tested the same way? Because yesterday we had the conversation with the doctors and who told us that our youngest case was a 14-year-old. So is the testing different for adults and children?
It's the same.
It's the same, even very young children.
There have been babies who've had it done too, yes.
Oh dear, okay.
Because there have been a few that have needed to have the test done for one reason or another. So yes, they have.
Okay, thank you very much for that answer. We're going to move now to the panel. Members of the media, we're going to go to Wendy at the Cayman Compass. Wendy, please go ahead with your questions for the panel.
You mean Wendy at Cayman News
Cayman
Service?
News Service, sorry, CNN.
I don't think the Compass would want me. Actually, the first question I have for the panel, it would really have been for the Commissioner, but I don't know what else to do with this question now because it's kind of mounting. The dump truck situation. Why are there so many dump trucks on the road? Is anybody able to say?
The only dump trucks that should be on the road are those who are working on the airport runway rehabilitation project.
So we have no explanation then for literally the significant number of dump trucks that I think everybody will agree. If you go out, the first thing you see is a dump truck.
Well, there may be significant numbers of dump trucks working on that project. I don't know that level of detail. All I'm saying is, as far as I'm aware, nobody else has permission to be operating dump trucks.
Okay, thank you. Actually, Donna, can you pass to someone else whilst I just recheck the remaining list of questions?
Sure, no worries. Reshma?
Thank you.
From the Cayman Compass.
Thank you, Donna. My first question was to the Governor in relation to the repatriation flights. You talked about the Mexican flight today. We saw that the Jamaican government has now opened up to allow the re-entry of nationals. I know the last time we touched on this issue, you said there were some challenges. Has any further discussions been had with the Jamaican government to open up borders to allow flights from Cayman to take Jamaican nationals back home?
I think it's all I want to say at the moment is that discussions are underway, but as we've emphasised regularly, this is quite challenging in a number of different areas with a number of different countries. And as soon as we've got something firm to report, we will. But it's best not to get into too much detail on that just now.
Okay, fair enough. This question has been one that has been coming from some Indian nationals in particular who are asking for an update on the discussions you had shared about UK visa waivers should their borders be open and they need to transit through the UK. They're worried that because they don't have the visa, it may pose a challenge for them. Can you provide some guidance or update on that particular issue?
Yeah, sure, Reshma, and we do understand that is a big concern for a lot of people. I mean, it's as much about the airlines because the airlines have to be certain that people have onward bookings. So we're speaking to the UK and we can try and get flexibility, but until people can show they have onward bookings and tickets to go somewhere else from London, then there's not a lot the UK can do, and the airlines as well. So it just remains very challenging, and we'll have to look at this sort of case by case. I think what would really help at some point with some of the large groups of foreign workers here is if their governments were able to arrange charter flights, and if we could link up charter flights from, say, India or the Philippines in London, we would be able to work through the transit visa issues. But that's a really complex and difficult logistical issue. And of course, at the moment, India's borders are closed. No Indians can go back to India. So, our hands are tied on that at the moment.
Okay, thank you. This question is for the Premier. We've been receiving reports from individuals who are trying to access their pensions, and they're being told that their employers have not been up to date on their contributions. What sort of recourse is available to them, or is government, say, beefing up the enforcement arm of the pensions regime to assist them in this regard?
Well, the law relating to them accessing their pensions was only passed yesterday by the Legislative Assembly. It's not in effect yet until His Excellency the Governor assents to it and it is gazetted. So I'm not sure why they would be attempting to access their pensions at this stage.
Well, I guess a lot of people are quite excited at the opportunity to access the pensions, so they're following up. But is there any guidance that you can provide for them, for those who are encountering this stumbling block?
If they have evidence or indication that employers have been essentially stealing their pensions contributions, then they need to make the report in the usual way to the department, and it'll be dealt with.
Okay, thank you. Today we saw the Chamber of Commerce release its employment stats and its projections for the number of unemployed, and they're predicting 10,000 jobs being lost by the end of the year. And basically, they don't think that the pension funds will be sufficient to assist people in covering that financial hardship. Are there any plans by government to maybe consider some sort of unemployment benefit to assist workers to supplement their finances in the interim?
We've already put in place, and it's being activated, a program for those people who need financial assistance to go through the Department of Children's Services, specifically NAU. That program is still in place. We've extended assistance to people who are not Caymanian but who are struggling with unemployment. So we've already have these mechanisms in place. We've now just put in place access by people to more than 25% of their pensions, because it's 10,000 plus 25% of what remains. So there will still be 75% of people's pensions remaining. So I wouldn't get too far ahead of ourselves in trying to plan for what's going to happen in 8 or 10 months. None of us really know where this is all going to end globally, let alone in Cayman. But I think we are putting ourselves in a very good place for the next 3 or 4 months to make sure that people have actual money in their hands. And if the projection is right, that this is about $500 million to be injected into the Cayman Islands economy, that is, I think, going to make a significant difference, particularly if the testing produces the sort of results that we are starting to cautiously be optimistic about. We will be able to reopen various aspects of the Cayman economy and start to have money circulating and keep people employed and businesses alive. The government has also produced a plan which will amount to about $15 million to help small businesses. And we're constantly looking at ways that we can continue to assist. But for us to get to a point where I, as Premier, can say that every unemployed person in Cayman is going to get 80% of what they used to get, we're not there. Government doesn't, and we're not going to get there. Government doesn't have the financial resources. The Cayman Islands government does to do that.
Okay, thank you. I'll give way to my colleagues. I still have a couple more questions.
Okay, I have a few questions from the public. The first one relates to the pension holiday. Premier McLaughlin, if for those who are listening that, can't read the laws or don't quite understand the changes that have been made, could you just explain the pension holiday to persons? Also, if you could answer this question, if an employer, for some reason, does not consider or take part in the pension holiday and are forcing their employees to still continue paying into their pension, what penalties could they face, if any?
Okay, the first question is once the law was passed yesterday, once it comes into effect, it will take effect retroactively to the 1st of April, which essentially means that the pension contributions by employer and employee from May going forward will not need to be paid for 6 months. It is a pension holiday, it's automatic. You don't have to apply for it. It simply means there is no longer any legal obligation on employer or employee to make those usual monthly contributions to your pension. If an employer and employee wish to continue making them, that is perfectly fine, but they will be treated as voluntary contributions. Because it's voluntary, the employee can't force the employer to do so, and the employer can't force the employee to do so. So if an employee says, I don't want to make voluntary contributions, the employer has no legal right to deduct the usual 5% from the employee's salary.
Okay, that's very clear. So I know you mentioned sometime this week that
penalties, I don't remember the details of the penalties, but they are. I don't have the law. Oh, I do have the law. What am I saying?
Okay.
Just let me check.
Sure, no worries. Thank you very much, Chairman McLaughlin.
I've forgotten I had this.
Yeah, I think it'll be very helpful for you to explain to persons who are listening.
Maybe we can get on with another question, and when I have a break, then I'll look rather than this dead time, right?
Yeah, no worries. So we've been hearing talk of the U.S. leader saying that they're going to open up U.S. borders, and I know that you said that we won't be following anything that the U.S. does, but the question is, how do you think that could affect us and our economy? If we decide to open up locally, what could it help us? Could it hurt us with them opening?
Well, I think that the U.S., the federal government and some of the states are courting real death and disaster. And that sadly, in 4 to 6 weeks, they're going to see massive spikes in the number of cases and much more death. But that's their call. So I wouldn't place a great deal of store in us believing that somehow them reopening is going to have some magical impact on the local economy, especially as long as our borders are closed. We still, I mean, the U.S. is a great friend, has always been of the Cayman Islands, and a place where all of us go for just about everything. So never for one moment do I want anyone to think that I am bad talking the U.S. It's just that I believe, as do many other people, that the federal government and some of the state governments are making some massively bad decisions that are having absolutely terrible effects on the health and well-being of their people. But that's their call.
Okay. I'm not sure you'd be able to answer this question, but I'm going to ask it anyway because it's a big one for a lot of parents. They're asking, okay, now school is closed for the rest of the school year. Is it being considered that maybe students will have to repeat the school year? Because when you take in the Christmas holiday and all the holidays in between, they haven't had a lot of time in school for the year. Is this something that might be considered that they repeat their school year?
Well, I know both the private schools and the public school system are striving to deliver quality education every day. Quite how successful that is, I think, is still to be judged. I haven't heard any discussions or had any discussions with the Minister of Education or anyone else about essentially a policy decision being taken to write off the year and start all over. Because that has all sorts of other implications as well. But I wouldn't put it beyond question. I think proper assessments will have to be done. And all schools are not the same. You know, some schools are better at delivering it than others. I mean, I'm just being frank about it. And so I'm sure those discussions will continue to go on. but we'll have the benefit of this summer break to be able. This is getting towards the end of April now, and schools generally resume the end of August, early September. I am hopeful and optimistic that we would be able to restart school if things play out the way that we're all hoping. And you know, I've been quite. A lot of people have said I've been very pessimistic about this, and so when you hear me starting to feel or actually express some optimism, I think you can place some store in it.
Thank you, Premier McLaughlin. Your Excellency, folks out there would like to know where the fundraising, the private sector fundraising program or initiative is, if we have any information on that.
Yes, I mean, I think that's a matter for the individuals involved in that, but I am aware that discussions are progressing in a very positive way, and I think next week there will be an announcement, which is something that both the Premier and I really welcome at this time, having the private sector step up. But there will definitely be more on that next week.
Okay. While our Premier looks up for the penalties on the pension holiday, we're going to go back to Wendy from CNS. Wendy, you have another question?
Yes, I do. Thank you, Donna. Appreciate that. This is one really that's come from the public, which has been going on for quite some time. The Premier did say some time ago now that he didn't think there was anything that government could do regarding the landlord and tenancy issues that we're having, because people are getting evicted and are fearful of eviction. And whilst the pension obviously will be helpful for a lot of people to enable them to pay rent, because that's going to take a while to come, we're still getting a lot of people asking, is it not possible for government to put some kind of temporary suspension on the concept of eviction? Or is that just not within the legal parameters of what government can do?
Well, I mean, Parliament can do I wouldn't say do anything, but can do a lot of things. I mean, we could pass legislation that dealt with that, which is a fairly radical measure. But what I was saying is that the current legislative framework that we have, or the lack thereof, to be frank, dealing with landlord and tenant issues doesn't allow the government to do that. We'd have to create bespoke legislation to deal with it.
And is there any consideration, or do you not feel that it is too radical a move?
No, I mean, we've talked about it, but no, we haven't sort of taken any decision to move in that way, because, you know, landlords are strapped as well, and landlords have obligations as well. So there are two sides to this coin. I've said before, and I've always thought that the increasing surfeit of rooms, of apartments, should cause landlords to act reasonably and try to hold on to good tenants, if indeed there is real hope that they will have the means to pay them in relatively short order.
Okay. And the final question is really about the situation with the banks. Minister Seymour has said a few times that he would like to see something happen. Again, is that not something that can happen? I mean, Minister Seymour, you keep raising it, so I'm just wondering, what is it is there something government can do, or is this just purely down to the banks not agreeing to change?
Well, we've had a number of discussions with the banks about this matter. The banks really don't want to open second branches because of the increased exposure to their staff that necessarily involves. Not opening other branches, though, is creating a massive inconvenience for people, particularly those in the eastern districts, that in some cases have to come all the way from Northside or East End to Camana Bay to get service at their bank. And so this is problematic. We are and have talked about possibly extending hours. What I would ask everyone for, though, is a little patience over the course of the next week or so, as we see how these test numbers turn out, because, quite frankly, if things go as well as I am and everybody else are hoping, we will probably start to see in relatively short order some significant adjustments to the shelter-in-place provisions, which I hope would allow access to more facilities and greater convenience to the general public without simply just returning to normal. Because if we're going to move, while we want to move in that direction, we have to do it very carefully and in a phased way, because, as I think all of us know, we don't want to repeat some of the lessons that are being taught in other places that have had relatively good success with containment of the virus.
Okay, thank you. Appreciate that.
I have a question for Minister Seymour. Minister Seymour, there's great concern amongst many people who are going to the supermarkets, the banks, as well as the pharmacies and so on and so forth to do their business on those given days, who are concerned that most of the people that are waiting in lines with them are not wearing masks. Are we any closer to making it a mandatory requirement?
Well, I'd say by next week. I was just informed today that the shipment I was hoping to deliver to the MLAs is coming in on Wednesday. So hopefully we'll be able to get those out before the next weekend and put a little bit more pressure on persons to wear masks.
Okay. I have a final question for Dr. Lee. Dr. Lee, we know that you've talked about healthcare workers, frontline workers, everybody on the front line being the first ones to get tested. Does this include those who are working in the restaurants that do delivery service, as well as those who are working in the supermarkets, the pharmacies, those areas?
Yes. All of these front-facing people that are dealing with the public are the groups that we're intending to test. In some circumstances, it's quite difficult to get hold of who may be able to collate the names and encourage the people to come forward for testing. And I have to say, the testing is we are asking people to be tested, but it's not a compulsory issue. We're not going to be forcing anybody to be tested in this way. Okay. But the more people are tested, the more helpful it is for us to know the true incidence. And I suspect a lot of people do want to know how they stand.
Okay. All right. Thank you very much, Dr. Lee. Any final words from our panelists?
Could I just say we've decided we won't be doing a press conference tomorrow and Sunday, and I think it is just worth underlining again. There are real grounds for sort of optimism and hope as we all go into the weekend, but we do need everyone to stick with this in terms of social distancing, staying at home, basic hygiene, and increasingly wearing masks in public places. I just want to finish very briefly on a lighter note. I just want to say on the steel pan that some of you will have seen, that I've been unbelievably amazed at the reaction to that. I think we've had over 50,000 views on social media, though my wife Lizzie was probably half of those. And I only have 3 tunes. One of them is Oh Christmas Tree, which I can't play, but I do have one other. So watch out over the next few days. There may be one more coming. And I've teamed up with Benny L. Miller and Chris Seymour, who are helping me with a remix with a little dubwise, as you say, around these parts. So
that'll be good.
Can't promise.
That'll be good.
We could turn the governor into Caymanian before he's gone.
Yes.
Donna, just to answer your question, the maximum fine is $10,000 or 1 year's imprisonment.
Okay. Thank you very much. Minister Seymour, any
Is that for playing the steel pan?
Okay. All right. So with that, before we go, a reminder to everyone to go online to gov.ky/coronavirus for answers to your questions. Of course, we'd like to thank everyone who's involved in making this press briefing possible today and throughout this week. That means the public and, of course, the viewing public as well, and the panel. Again, we invite you to join us here on Monday. We'll leave you now with a look at the regional and worldwide coronavirus statistics. Have a great weekend.
serenity in yonder deep, the fear of death, but you pray, O Lord, for your soul to keep. Dear boredom, nothing but a selfish film over our eyes. Some people just don't get it. COVID-19 is a murderer, and your defiance reflects upon your character. Yes, I get it. Cabin fever is a breeding ground for depression, but I have a confession. Yes, you guessed it. We are in this together, and although our stories are not the same, they are similar enough to understand the pain. Read a book. Engage your mind. Don't give negativity the time to fester. Don't let it rule you, so that Cayman 2 can see this through. Those beloved smiles that we shared with friends doesn't have to end, but you are consumed by what you do not have. When the health of Cayman is in your hands, there are many without work. They can't go to Kirk's in a panic, worry about organic. Premier says to live frugally so that repercussions don't hit so brutally. Read a book, they say. However, it is true. To discover something your mind never knew, educational absorbency in this time of uncertainty. Together, Cayman, together. Together, let's stay home, not just you alone. This is not a punishment, but a journey to success, to restore our faith in the human touch and the beauty of shared air. Together, we are a nation. Together, we are stronger.